Okay, today we're going to talk about something that's incredibly difficult, but also incredibly important. We're looking at what happens when a cancer diagnosis is missed or delayed here in Scotland. We're going to break down the types of failures, the legal side of things, and the practical steps involved to give you a much clearer picture.
I mean, just think about that for a second. It's a truly devastating thought. And that's really what this explainer is all about, trying to bring some clarity to what is, for many, a complex and deeply emotional situation, and helping you understand the framework for what happens next.
So, to kick things off, let's explore the different ways a critical diagnosis like this can be overlooked in the first place. To really wrap our heads around this problem, it helps to see how these clinical failures are actually categorized, because, they aren't all the same, and the specific details of what went wrong, well, they really matter.
You see, a misdiagnosis isn't just one single event. It can be a delay in finding the cancer, a mistake in reading a test result, a failure to send a patient for the right investigation, or even an error in a routine screening program. Each of these can have profound consequences. So let's look at a few of the most common ones right now.
This is probably the one you hear about most often, a delayed diagnosis. Now, the issue here isn't that the cancer was missed entirely, but that critical, valuable time was lost. The real harm is measured by looking at how much the cancer progressed during that period of delay.
But errors can also happen even when all the right tests are done. For instance, a specialist, say a radiologist looking at an X-ray, or a pathologist examining a tissue sample, might unfortunately report it as being all clear. This can give a patient a false sense of security and lead to a critical and sometimes tragic delay in treatment.
Now, this one is huge, especially in primary care. Your GP is often that first line of defense. And if a patient comes in with symptoms that, according to official guidelines, should trigger an urgent referral for suspected cancer, a failure to make that referral can be the first devastating link in a chain of events.
So, let's say a potential failure has been identified. How does the Scottish legal system figure out if it was actually negligent? You see, it's not just about a mistake happening. It has to meet a very specific legal standard.
And in Scotland, it all comes down to this: the Hunter v. Hanley standard. The best way to think of it is as the legal yardstick. It's used to measure a doctor's actions against what their professional peers would have done in the same situation.
Okay, so to succeed in a claim, you have to satisfy all three parts of this test. First, you've got to establish what the normal accepted practice is. Second, you have to show that the doctor strayed from it. And third, and honestly, this is often the highest hurdle, you have to prove that the way they strayed was something no competent professional exercising ordinary skill would have ever done.
And you might be wondering, what exactly is normal practice? Well, it's not just a matter of opinion. It's often clearly defined by established clinical guidelines from respected bodies. So if a doctor fails to follow a really clear guideline for, say, an urgent cancer referral, that's pretty strong evidence that they departed from accepted practice.
Now here's where things get even more complicated. Proving a mistake happened, well, that's really only half the battle. The next, and often much tougher step, is proving causation. In other words, showing what actual difference that mistake made to the patient's health.
This is it. This is the central question that everything else hinges on. Did that delay change the prognosis? Did it take away treatment options that would have been on the table? Did it ultimately shorten a person's life? This is almost always the most complex and contested part of any claim.
And when you're trying to answer that question, it usually falls into one of two buckets. The most clear-cut and tragic cases are where delay literally turns a curable cancer into an incurable one. But even if the cancer was already advanced, a claim can still succeed if you can show the delay meant the patient had fewer treatment options, more suffering, or a shorter life than they should have had.
But what happens when the outcome was never a sure thing? Well, things can get pretty nuanced with this legal idea called loss of chance. Say a timely diagnosis offered a 60% chance of a cure, but the delay knocked that down to just 20%. The claim then focuses on the value of that lost 40% chance. It's how the law tries to grapple with uncertain outcomes.
All right, for our final section, let's get really practical, because understanding these next steps can make a truly daunting situation feel just a little more manageable.
If you or someone you know is in this situation, these three things are absolutely critical. First, these cases are incredibly complex, so you need a specialist solicitor. Second, getting all the relevant medical records is the absolute foundation of any investigation. And third, it is vital to act quickly, because there's a strict 3-year time limit for making a claim.
And it's useful to know how this works.
When a claim is made against NHS Scotland, it's not the hospital or the GP practice that responds. It's a body called the Central Legal Office, or CLO. They'll conduct their own investigation, using their own experts to decide whether they should defend the claim or try to settle it.
And if a claim is successful, what does compensation actually cover? It's really important to understand that it's designed to cover the full spectrum of loss. This includes not just the physical and emotional suffering, but also lost income, the costs of care, and, in the most tragic fatal cases, the financial support the family has lost.
And that really brings us full circle, back to this fundamental question. Because behind all the legal tests and all the medical evidence, this is what it's really all about. It's a question about lost opportunities, lost futures, and the profound, immeasurable cost of lost time.